Here's the truth. Many people with bipolar 2 disorder are first misdiagnosed with depression, and that delay can prevent them from getting the help they truly need. That is because the early symptoms often look exactly like depression, like the persistent sadness, the fatigue, difficulty concentrating, loss of interest in pleasurable activities, changes in sleep or appetite, feelings of guilt. When clinicians see these signs, it is easy to think it is major depressive disorder, but for some, there is more happening beneath the surface. Hi, I'm Dr. Georgette Kui, a psychiatric provider who helps people and clinicians understand mental health conditions clearly. In this video, I'm going to show you a case study that explains how bipolar 2 disorder can first appear as depression. We are also going to look at the main signs and symptoms that tear them apart. We are going to look at some screening tools that you can use for each disorder. And we are also going to cover practical tips to avoid missing the right diagnosis. So let's start with this case study. Maria is a 29-year-old creative graphic designer who is always full of ideas. But lately, she's been tired, sad, disconnected from her work. She tells her doctor, I just feel empty. She sleeps about 10 to 12 hours a day, struggles to eat or get out of bed, misses deadlines, finds no joy in activities she once loved. She's withdrawn from friends and cries for no clear reason. Her doctor diagnoses her with major depressive disorder and starts her on antidepressants. For a few weeks, Maria feels better. She's sleeping less, working more, and feeling motivated again. Then suddenly, her mood shifts. She begins staying up all night, working on new projects, talking rapidly, brimming with ideas. She spends thousands on new equipment and impulsively books a trip abroad. Friends say that she seems different, confident, unstoppable, and almost euphoric. But within weeks, she crashes again, back into exhaustion, sadness, self-doubt. So what's really happening here? Is this depression, or could it be bipolar 2 disorder that initially mimic depression? Before we continue with this, I want to pause and share a game-changing tool that is helping healthcare providers across different medical specialties document complex cases like Maria efficiently. It is called Companion Medical Scribe AI. As healthcare providers, we see patients with complicated emotional presentations all the time, and documenting them accurately can take hours. That is why we recommend Companion Medical Scribe AI, which is HIPAA-compliant clinical assistant that helps with real-time documentation and decision support. Here's what it can do for you. It can help you generate complete detailed clinical notes, including history, assessment, plan in seconds. It can suggest possible diagnosis, evidence-based treatments. It can recommend medications, doses, using trusted guidelines. It can create referral letters, follow-up summaries, patient education materials. It can also add ICD-10 and billing codes automatically. It can help you answer clinical questions instantly with verified evidence-based sources. It integrates easily with any EHR, just copy and paste your notes. It's like having a knowledgeable assistant that saves you hours of chatting while helping you make more confident clinical decisions. Now, let's return to the clinical discussion. How to differentiate major depressive disorder from bipolar 2 disorder according to the DSM-5-TR criteria. So for major depressive disorder, the person has to present with 5 or more symptoms for at least 2 weeks, including sad or empty mood, loss of interest or pleasure. Other symptoms of the depressive side of it might include fatigue, loss of energy, insomnia, hypersomnia, poor concentration, appetite or weight changes, feelings of worthlessness or guilt, thoughts of self-harm, suicidal thoughts, no history of manic or hypomanic episodes. Now, when it comes to bipolar 2 disorder, at least 1 hypomanic episode and 1 major depressive episode, no full manic episodes. Hypomania can present with elevated, expansive, or irritable mood with increased activity or energy lasting at least 4 days. Change in functioning is noticeable to others, but not severe enough to cause major impairment or require hospitalization. So the clinical clue: if a patient describes periods of feeling unusually good, productive, energized, or needing little sleep, consider bipolar 2, not just depression. So some screening tools that we can use for depression, we have the PHQ-9, that is very quick. We can use the Beck Depression Inventory. We can also use the Hamilton Depression Rating Scale. This can be used for bipolar spectrum disorder. There are a lot of tools that can be used. For example, the Mood Disorder Questionnaire can help screen hypomanic and manic symptoms. The Hypomania Checklist can also help with that. Even the Bipolar Spectrum Diagnostic Scale can assess mood fluctuations across the spectrum. Clinical Pulse for psychiatric provider. Ask about elevated moods, not just sadness. Many patients overlook hypomania because it feels positive or productive. Assess family history of bipolar disorder because a family history increases the risk. Sleep pattern changes to are early indicators of mood shifts. Antidepressants induced hypomania can reveal an underlying bipolar spectrum disorder. Monitor mood longitudinally. A single visit often doesn't capture the full cycle. So the next time you meet a patient like Maria, remember that not every depression is just depression. Sometimes it is part of a larger cyclical pattern that requires different treatment approach. And if you're a clinician who wants to save time, make evidence-based decisions, and spend more time connecting with your patients, try using Companion Medical Scribe AI. It is fast, secure, and built for real clinical work. And also, if you're a psychiatric mental health nurse practitioner who is preparing for the certification exam, maybe the ANCC or the AMP, check out Georgette's PMHMP certification review courses. It is trusted nationwide, and it has helped thousands of NPs prepare for their PMHMP certification exam. So if you like this content, follow for more content.